So yesterday we start about head and neck radiology. So what are the mode of radiology or modalities we discussed yesterday? When to use CT scan, when to use MRI, use USG or X-ray. We discussed in previous class. So today we will discuss. I also told that in previous class we have to discuss three things. Okay, PNS radiology, paranasosinal radiology. So today we will discuss paranasal sinus radiology and as well as pathology. Important diseases which we can see in our regular practice. So what is PNS? So this image will help you to understand. Okay, this is paranasal sinuses. So in the head region, we have free space. There are the free spaces to what is the function? To exhale and inhale the air, okay, to bring the air, whatever air resistance, to protect the air resistance. So we have this sinuses. So we have four types of sinuses. First is this is frontal region, frontal sinuses. Sinus is nothing but space. Frontal, this is the part, this is the name of the area, frontal. And you can see this is the in the nasal area. We have two sinuses. First is ethmoid, and above that we have sphenoid. You can see that this is the ethmoid. Okay, ethmoid. Okay, and in the below that we have this area. This is maxillary sinus. Maxillary sinus. This is space to protect the air resistance. Okay, so this is the anatomy of paranasal sinuses. We have four types of sinuses. First is frontal sinuses. Second is ethmoid sinuses. Third is sphenoid sinuses, and fourth one is maxillary sinuses. So these are the very important names we have to remember. Next image we will show you that what the pathology, the sinus, now what called sinusitis, the most common disease nowadays of upper respiratory system, or we call head disease. So in the healthy sinuses, okay, you can see this image. Okay, sinusitis, healthy sinuses, frontal sinus, sphenoid sinus, or ethmoid sinus, and maxillary sinus, nasal cavity. But in sinusitis, what will happen? There is an inflammation. There is an inflammation in that area. Okay, mucus. The mucus is present in that area. It will have inflammation, and the patient have running nose. Mucus will come from that from the nose. Okay, so what will happen? Uh, Nasal mucus will come. Okay, the patient have plugged nose means something has someone is pulling down. Okay, and facial pain, here pain, here pain, here the pain is there, here in this area. The patient have fever if it is highly inflammation is there, sometimes fever is there, headache. Okay, so these are the symptoms of sinus. Okay, so what is the investigation of choice? What is the investigation of choice in sinusitis? The investigation of choice in sinusitis is HRCT of head or PNS. HRCT of PNS, paranasal sinuses. So in that you will get clear picture of sinuses, and the most common sinus sinusitis is maxillary sinus. In that area, the most common inflammation are seen most of the patient. Okay, so these are the important things. Now you can see the image. You can see this image, maxillary sinusitis. So you can see this is the CT scan of head, frontal view. Okay, so these are the nose, orbitus. Okay, this is the maxillary sinus. This is the brain. This is the skull. We have facial bones, different types of facial bone. 14 bones are there, 8 cranial bones. You can see mandible, maxillary, everything here. You can see this area is maxillary. So you have to like this air filled. Okay, how you get black color. But here you can see that this is filled with mucus. Okay, this is maxillary sinusitis. Patient have more problem. Okay, so we have to treat that patient if he present with this type of problem. So this is the maxillary sinusitis. One image I shown. So this is about sinusitis. Next we have another disease, most common pathology nowadays are seen, that is nasal polyps. Second one is nasal polyps. Nasal polyps is nothing but growth, extra amount of growth in the nasal cavity. So this is the nose. So in that area, any unwanted growth is developed. So we will call is nasal polyps. Extra growth in nasal cavity. Okay. So what is the investigation of choice? NCCT of PNS or head, sorry, or facial area. You can go to or nasal area. So let's see the images to understand. So you can see this is the side view. Okay. This is the nasal polyps. You can see unwanted growth. Okay. If the patient have nasal congestion, swallowing nose, runny nose, water dripping from the nose, and having constant cold, sometimes cough, sometimes they have a loss of taste, smell, okay, blockages of nose, unable to take the breathing, okay, and sometimes nose bleeding, facial pain, headache, vision problems. All these are seen in this nasal polyps. So this is the nasal polyps. You can see the images. Okay, you can see this is the nasal polyps. You can see the polyps reach floor of nose. This is the space we have to no blockage. You can see here. Here you can see there's a blockage. All the areas blockage. Extra amount of growth is seen there. Okay. So this is called nasal polyps. So the what is the investigation of choice? CT scan of head or CT scan of facial region or nasal area, nasal cavity. Okay. Next we have, after that we have third common pathological condition. Okay, we have to see, that is facial trauma. It is due to anything, accident or falling from the height, or due to falling from the slip by slip. Okay, anything. Facial trauma. Facial means the bones of the facial are broken or any fractured happen. Okay, so the most common signs of facial trauma are two. One is running nose. Okay, and second is running nose. Sometimes water will come, sometimes CSF will come. Leakage of barrier between the brain and the nose. The barrier broke down, so that's the reason the CSF is coming from outside that area. So we'll call CSF a rhinorrhea. What we will call CSF rhinorrhea. And what is the investigation of choice? Investigation of choice is CT cysternography. Cysto Cysternography is the investigation of choice. You can see the images here. So these are the facial bones are that. Okay. Facial bones are that. Okay. You can have any fracture will happen anywhere. So temporal fracture, orbital fracture, nasal fracture, mandible fracture, maxillary fracture, teeth fracture or teeth fell down. So anything will happen. So nowadays, cysternography is also there. And nowadays, 3D images are also coming. We can see this image. This is the 3D image, which shows the s- facial bones very clearly. So here some of the fractures happen, okay, to that patient, okay, due to the trauma, RTA, head injury or injury. Okay. Next, most common pathology, that is nasal bone fracture. First, we discuss sinusitis, nasal polyps, facial trauma. Now, nasal bone fracture. Nasal fracture means nasal bone. This is a between two nostrils. We have one nasal bone. Septa, we will call septals. So, for that, the investigation of choice or these NCCT. Okay, let's see the image. We can see this is the nasal bone. Okay, here the fracture is happened. You can see the the bone is not there. There is it is septa deviation is there. Okay, in the CT scan you can see image very clearly. This you see this is a breakdown of nasal bone due to injury, trauma, or anyone hated. So there are numerous reasons. Okay, so these are the PNS pathology, paranasal sinus pathology. Next, last common type of diseases, but here I didn't got any type of scans for this disease. Okay, so that's the reason I am explaining here only. Next is juvenile nasopharyngeal angiofibroma. Na naso nasal region pharynx. Here we have the pharynx. In between, there is a tumor. This is the most common nasopharyngeal angiofibroma. So it is between nasal and pharynx. In that there is a tumor. Okay, what is the sign? Symptoms. Most common sign is epistaxis. Epistaxis means nasal bleed. Nasal bleed. The blood coming from the nasal region. So what is the investigation of choice? The investigation of choice is first CT angiography of head and neck. Okay. So these are the common pathological diseases. Okay, where the patient comes in your clinic with nasal fracture, sometimes any fracture from on the face, nasal polyps, sinusitis, and nasal bleed also. So these are the PNS pathology. So we discussed PNS pathologies and as well as PNS anatomy. So we have two things, that is orbital pathologies and neck pathology. So we'll discuss tomorrow. Tomorrow we'll discuss the important pathological conditions, what are the investigation of choice for the disease and how it looks like in radiography, radiology. So we'll discuss tomorrow. So any doubts, kindly ask.